Thank you very much. And good morning to everybody. It's still the morning in my country. It's my honor and pleasure to be part of this audience. And I hope that sharing our experience on the work that we do in informal settlements in South Africa will actually just educate other people about what issues, especially concerning the environment, we have to deal with in the delivery of healthcare. So I'm going to talk about navigating the, now the screen is blocking me, okay. Navigating the environmental health issues in informal settlements. This is in the process of us delivering a community-oriented primary care service program in Tshwane. Tshwane is in the city of Pretoria in South Africa. And we've been running this program since about 2015-16. It's been developing and it's been work in progress. We're not there because there are lots of different encounters on a daily basis, but we're getting there. Okay, maybe first of all, let's talk about what is community-oriented primary care, because a familiar term to some people. So COPC is primary care where professionals from different disciplines and approaches work together with organizations and people in defined communities to identify and respond systematically to health and health-related needs, meaning the social and environmental determinants of health, in order to improve health. But the question is, what is the difference between primary care and primary health care? And in this regard, I just decided to look into the definitions of the World Health Organization, which we're all familiar with, where it says primary care is a key process in a health system that provides promotive, protective, preventive, curative, rehabilitative, and palliative services throughout the life course. So it's person-centered. Primary health care, on the other hand, is a broader whole-of-society approach with three components. So it involves primary care and essential public health functions as a role of integrated health services. It also involves multi-sectoral policy and action, and it also involves empowered people and communities. So there is quite an overlap, but primary care actually focuses on the individual that's being cared for, as opposed to the broader system. And there are some key facts, according to the WHO, that play a role in terms of primary care. One of them is aging population growth and a rising burden of non-communicable diseases are driving the transformation of primary care. And primary care has been shown to meet most of a person's health needs throughout their lives. So again, the person-centeredness is very key here, meaning the person within their environment and their context. So what does the COPC approach entail then in terms of our program? It's implemented in terms of 5 principles that guide it. The first principle is to look at local health and institutional analysis. So this is the context within which the person being cared for is situated. Principle 2 is comprehensive care, and I'll just take you through the cycle of comprehensive care, but it basically involves promotion, prevention, curative services, rehabilitative services, and palliative services. Principle 3 is about equity. Principle 4 is about practice with science. And principle 5 is service integration around users. And I'll take you briefly through each of these principles. If you look at principle one is about deriving information from and working with local people and organizations in defined geographical areas where the individual, in other words, the service user is based. So you're looking at the context, you're looking at what is available, you're looking at what social supports are around the individual. In terms of principle 2, which is comprehensive care, we've got, of course, promotion, prevention, early detection, curative, rehabilitative, and palliation services. And in terms of principle 3, equity, we're talking about services and care that are accessible, affordable, appropriate, and relevant. And these must prioritize those with the greatest need. So again, centering on the user, and while simultaneously ensuring that those with the same need get the same services and attention, irrespective of their color, social standing, and other differences. Practice with science, the principle involves offering the highest quality of care by informing practice through science, and by making sure that practice with science is interdisciplinary and multi-professional. Because of course, you cannot deliver health services in isolation. There are other factors that play a role. Service integration around users, again, person-centered. People and practitioners should be working in partnership, and there should be a continuity of care. Now, if you look at principle 2, comprehensive care, it goes through a cycle on a continuum between health and disease. And we're talking promotion, prevention, treatment, rehabilitation. And again, we're talking, on the other hand, the same loop, which ends with palliation if the disease cannot be cured, of course. Now, let's talk about the work that we are doing, because this presentation is about our experience. So we run what is called the COPC Research Unit, which is a research entity within the University of Pretoria. And it is community-based, very much community-oriented. It works across disciplines. And I'll just talk about the vision. The vision of this research unit is to be the leading transdisciplinary research, learning, and service innovation hub, grounded on COPC principles and serving the underserved communities. So that's our focus, the underserved communities. As a result, we contribute to the re-engineering of primary health care using an ICT-enabled COPC model, while promoting translational transdisciplinary research and service learning. So there is a service component, there is a research component, but also there is a learning component. Our mission is building a transdisciplinary research platform that serves to educate and train undergraduate and graduate students across faculties, skilling them to deliver quality health and well-being services to especially vulnerable populations living in the country, to support the delivery of quality health care in underserved communities across South Africa, and to engage in basic and applied research in the implementation of our services. So what are our current activities that have actually given us some lessons in terms of the environmental factors? And I've just summarized them. Number one, the COPC implementation and research, which focuses on vulnerable and underserved communities. These include informal settlements, mining communities, substance users, and homeless shelters. Informal settlements are situated at various areas around the city of Tshwane. Mining communities are away from our own vicinity, They are in different provinces, but here we work in partnership with mining companies to deliver services to these communities. And of course, within the scope of occupational health. Then we've got substance users as one of the communities. And we offer harm reduction services to these groupings. And then, of course, there are various homeless shelters, and we offer health services in these shelters. Our research projects include a longitudinal project called the Supreme GRT, which is a national project, and we are one of the nodes. It's a health and demographic surveillance system that is funded by the Department of Science and Innovation. Then we also offer the community-oriented substance use program called COSUP, the point of care ultrasound projects, one focusing on early diagnosis for cancer and one focusing on monitoring fetal growth. And then there's also early screening for TB using a face mask. There's workplace learning for students, mainly undergrad, which is the clinical associates or physician assistants, which are the BCMP, and also the medical students, MPCHB, and then postgrads in terms of the MMeds. Those are the specializing family physicians, and also interdisciplinary postgrad degrees in the form of master's and doctoral degrees. So in our implementation, we actually start at household level, where we do visits for health assessments. And these are being done by community health workers and students. And we make sure that community health workers are actually people who are based in the area. And then students, of course, tag along so they can learn how to do assessments at household level. Then we've got satellite clinics that are situated at informal settlements, but also we actually use these as our basis for linking patients to further care. And this is where we then involve other disciplines around whatever social and environmental determinants of health have been identified. There's also a nutrition and gardening program, which we offer to the community and also to early childhood development centers. We support these early childhood development centers in various ways, some of them being to do health promotion and to train teachers around areas of childcare. Then we do health promotion activities and campaigns in the community through working with non-profit organizations. And these focus on various areas like HIV, like vaccination and so forth. But then what are the environmental issues that we have to navigate? Informal settlements in particular have a lack of clean water and poor water quality. There's land pollution, there's air pollution, there's deforestation, there's lack of sanitation, there's unplanned building sites. Some of the residents haven't built on wetlands, and some haven't built on top of bulk electricity cables that are supplying neighboring industrial areas. And there's overcrowding, and there are infrastructure challenges in the form of roads that have gaping holes and potholes. But how do we then mitigate these environmental issues? We hold community discussions about water resource management, and we've had a project where we did water quality testing, and it was amazing. I mean, the municipality is delivering water through water tankers, but this water we actually found that it's also not safe. So we tested the water, and we had to advise residents not to actually consume this water, but they can use it for other things. Community meetings about environmental issues in the area. These are discussed on an ongoing basis through community engagement meetings, but we also have a project called Co-Creating Wellness, that we are undertaking with quite a number of faculties within the university. And this project is about the development of community action plans to address immediate challenges of health, dignity, safety, and education faced by the communities living in these settlements. And the report will be presented to the municipality in a way of mobilizing the municipality to actually tackle these environmental issues. We do health education at the clinic and also community events. We have developed educational videos on various health and hygiene practices, especially during the COVID period. These were, we've got quite a suite of these videos. Community engagement includes exploring reasons for resisting to relocate from the harmful sites because residents just go up in arms when they are advised by the municipality to move. Preventive programs are introduced as per need, for instance, vaccination, early disease detection. We also mobilized the veterinary faculty to come and vaccinate animals when there was an outbreak of rabies. Okay, at this point, I would like to thank you for your attention.